Let me ask this then of defense counsel. How many witnesses are you planning on calling this morning?
I anticipate one. We had two doctors that had the opportunity to interview Mr. Wilson.
The thing I'm testifying to is that his brain is such that he's more likely to be impulsive without recourse to consequences, easily agitated, and easily this fits within the realm of possibility.
Well, it also fits in the realm of other possibilities, does it not?
Objection, speculation.
Overruled at this point.
What are you talking about?
Well, you're assigning his actions to one particular thing.
Well, it's going to be multifactorial. This is just one aspect to his behavior. He's going to have drug use. He's going to have whatever is going through his head at the time. This is just one aspect that makes him more likely to do something awful than not.
Did it affect his ability to have a relationship with an individual back in October of 2019?
It doesn't stop him doing that, but it likely makes him more likely to be tumultuous.
How do you know?
I'm just saying, from his abnormalities, this is behavior that I would expect. I don't know it, I expect it.
Well, did you have an opportunity to corroborate any of that information? Did you have an opportunity to speak with a young lady by the name of Miss Melissa Montanez?
I don't know who that is, so no.
Okay.
But I had an opportunity to see him overreact and do things that he didn't want to do just when I was doing the mocha. I saw that behavior right there.
Well, it was in fact true, sir, that you didn't have an opportunity to see how he was acting back in October of 2019.
I met him last week. How am I supposed to know what he did in 2019?
Well, aren't you here to explain his actions back on the 7th of October of 2019, sir?
Based on his neurological abnormalities only.
You don't know what his ability was and what was going through his head when he went to a music venue that night, did you?
As ventricular asymmetry is typically congenital and atrophy takes time to develop, I would position that these findings are likely predating 2019, probably sometime after when he was a teenager.
Well, if they were
Before he was a
predating 2019, you would expect some kind of symptoms to be present at that point in time, would you not?
Impulsiveness, agitation, how do I know that's not there? I would say that it's likely that he had those things then.
Really? Well, you didn't bother to go ahead and speak to Mr. Lukic or Miss Stephanie Johnson, who had contact with him. You didn't have contact with Miss Melissa Montanez, who could tell you a little bit more about her contact with Mr. Wilson, did you, sir?
I did not know them. How am I supposed to contact them?
Well, you had the case report, did you not, sir?
I did not have the case report, no.
You didn't have the case report as it applied.
I did not have any of that, no.
Sir.
From a perspective of major disease, stroke, MS, anything you look at, yeah, it looks normal.
In fact, the findings in the MRI scans were that the ventricles are normal in size and position without evidence for hydrocephalus.
There is no hydrocephalus. In fact, the ventricles are relatively small, indicating that he may have increased intracranial pressure.
And then we also find that the fourth ventricle is midline and no shift is noted, right?
Yeah, that's brainstem. That's fine. It also says that it alludes that neuroquant was not done. No computerized evaluation of the MRI was performed,
Well,
which is not order.
in order to do a neuroquant, wouldn't you agree with me that that's just a computer analysis to quantify those matters, isn't that right?
It is, and also to put validity in what I'm saying versus what the radiologist is saying. Who's right? Who's wrong?
Well, if there's really nothing to quantify, then why do a neuroquant to begin with?
The ventricles are asymmetrical. That would showed up on neuroquant. His anterior temporal lobes are atrophy compared to the rest of his left parietal lobe.
Well, doctor, when we're talking about the MRI scan and the CT scans, both of the radiologists that had gone ahead and reviewed both of those particular records found them to be normal. But you're telling us here today that you found abnormalities.
Abnormal as it regards to behavior. When you have asymmetrical ventricles and you have some relative atrophy compared to the rest of the brain. These are not gross abnormalities.
All right, well, let's talk about his behavior a little bit. Do you have any independent corroboration besides what Mr. Wilson told you on that particular day when you did the assessment and reviewed some of the records in this particular case with regards to the homicide that took place on the 7th of October of 2019?
The homicide itself, I was looking through my records and I have no documentation of the action of the murders. All I saw was I was able to see online. And I don't know if that's correct or not, so I can't testify to it.
Sir, do you remember giving a deposition yesterday?
No, I don't remember this today.
All right. Matter of fact, one of the questions I had specifically asked you was whether or not, and I wanted to make sure that I understood you correctly, was that you said you had a criminal justice face sheet, you said you had a case report, you said you had a series of medical records, you had a letter from Mr. Wilson, and then you had a school records. And I asked you if that was accurate.
I had a face sheet, but it was Department of Juvenile Justice face sheet.
I also asked you, sir, whether or not you had a case report, and you told me that it was accurate.
And I must have misspoke because I do not have that.
So you misspoke twice?
It's a record. I have a bunch of records that look like jail medical records that are all a couple hundred pages each of just mundane information. So, yes, I misspoke twice.
So getting back to October 7th of 2019, did you have an opportunity to speak to some ladies by the name of Shayna Williamson, Dawn Griffin, and Amy Slobodian about what they saw?
I do not know who they are. I didn't know they were involved, and I did not talk to them, no.
Okay. Did you have an opportunity to review a statement of an officer by the name of Timothy McCormick, which depicted his
No, I did
contact
not.
with Mr. Wilson?
I did not talk to anybody, so I'll save you some time.
Well, did you have an opportunity to watch the video of the interaction between the officer and Mr. Wilson?
There's a video? No, I don't have that video.
Did you have an opportunity to watch the video of the interaction that Mr. Wilson had with the audio of the interaction that Mr. Wilson had with Detective Nick Jones?
No.
Did you have an opportunity to listen to any of the jail calls that Mr. Wilson had made to a number of individuals?
No.
Have you had an opportunity to review any of the emails, numerous emails that Mr. Wilson has gone ahead and sent out?
Didn't have them, so
So if he was able to recount details of the murder and those details were backed up with evidence, you'd agree with me that his executive functioning or his ability to remember these items and what you have gone ahead and learned as a result of your assessment of Mr. Wilson may not necessarily be accurate?
long-term memory and memory events that are very impactful tend to stick better than shoe, red, velvet.
Well, when Mr. Wilson goes ahead and kills Miss Melton early in the morning, proceeds to attack Miss Montanez shortly thereafter, and then goes ahead and kills Ms. Diane Ruiz within a matter of 6 hours, and then goes ahead and reports that to Mr. Joshua Lukic, you'd agree with me that's relatively short-term memory, would you not?
Mr. Wilson had head trauma in 2023.
Yes.
So he had head trauma that he didn't even report to you, on top of the other head trauma that he did report to you.
Correct.
Now, just for clarification, CAT scan normally done at the hospital right after an accident?
Yes.
They don't always do an MRI?
No, MRIs are more expensive, they take longer, and you need something in the emergency room to be very quick. CAT scans are quick, and they tell you what you need to know. They tell you that whether there's a hemorrhage, again, skull fracture, epidural hematoma, subdural hematoma, subarachnoid hemorrhage. Those are things you're looking for.
Something that you want to know so that you could act in an exigent circumstance in order to stop that.
Right, if he needs to be referred to neurosurgery and have a hole put into his head to drain a subdural hematoma, then he needs to have that done. But there's no bleeding, then there's really nothing to get overly concerned about, because if there's like enteroparenchymal hemorrhage, then they'd be admitted for watching for swelling, and they may need to have a flap put in their skull. Yeah,
But if he has brain trauma, that wouldn't necessitate a CAT scan, would it?
brain trauma?
Yes.
Well, typically you do a CAT scan if there's head injury because you got to make sure that you don't miss a bleed. If you miss a bleed, you're going to get sued.
All right, but do you have to have a bleed every time you have brain trauma?
No, most of the time you don't.
So a CAT scan wouldn't help you if you're trying to do the analysis that you were trying to perform with Mr. Wilson.
Only if it's grossly abnormal.
The test results from Dr. Eisenstein, you had an opportunity to review them,
The test sheets, yes, I couldn't make heads or tail of them.
but nothing in there stood out as being inconsistent with your diagnosis here today.
No, because I couldn't make heads or tail of them.
But he's in there reviewing, he's a neuropsychologist. Just because it says neuro, he's not testing for the same thing that you are.
That's correct. Neuropsychologist is different than neurology.
All right. So as a result of his testimony, that of the psychiatrist, Dr. Mills, they're more focusing on things like the bipolar, and it's not schizophrenia, schizoaffective disorder. They're focusing more on those types of things.
All right.
And you're looking at long-term brain injury, for lack of a better term.
I'm looking at neurological consequences of trauma and development. The ventricular asymmetry is important because he has psychiatric disease.
You mentioned the term atrophy a few times. Would you contemplate that there would be additional atrophy in the future?
This is me speculating, so I don't know, but as he ages and there's general atrophy, he'll have more atrophy in his frontal lobe and his temporal lobes.
But you said medication may help?
Medication could adjust behavior at modifying some of the impulsiveness, the agitation.
It's not going to regenerate brain tissue.
No, it's not going to bring it back, but it could be treated.
Were you aware that he had consumed drugs that evening before he committed any of the homicides?
I was aware of drugs, yes.
Okay. Do you know what type of drugs?
No, because I was aware because I read it online somewhere.
Would controlled substances, depending on what it was, aggravate the anticipated conduct of Mr. Wilson?
It all depends on what it is. I mean, marijuana would tend to calm someone down. Methamphetamine would make him much more agitated, and any kind of the stimulants would make him more easily act without thinking.
Okay. So there are controlled substances out there, depending on what he took, that could have made him a lot worse that evening.
Yes.
Now, the fact Mr. Wilson killed a woman with his bare hands at some point in time during their conduct with each other, then a couple of hours later, he goes out and he savagely attacks his girlfriend, and then a couple of hours after that, he goes out and kills another woman. Is that the type of conduct that you would expect and anticipate from somebody with
His brain injuries, his psychiatric disease, as well as the drugs he's on, likely resulted in this awful behavior.
I don't have any further questions.
Now, would you agree that drugs could affect your ability to think or to plan and to cause you to act impulsively?
Absolutely. Yeah.
And would you agree that people can just do evil acts without having brain injury
Yes.
or without having a mental diagnosis?
Yes.
Now, as part of Dr. Rubino's testimony, he prepared a PowerPoint, and I'm going to ask you in just a moment to come down. I want to ask you questions about those scans. What do you note about this first scan?
This is a horizontal section through the brain. You're looking here at the ventricles, which look more white, if you will. And what he is claiming that there is asymmetry between these two structures. But by looking at the posterior horns here, you can see the length difference between the two. That's because this is not a complete level section through the brain. You're looking at a different level from the right compared to the left, so you're not comparing the same. So you can't make an accurate measurement here from one side to the other. You're going to get different measurements because of that.
And
So you have to look at the volume of the entirety of the ventricle.
And so based on that, do you believe there's anything significant?
No,
about
and I'll tell you further why, right? So if you had asymmetry in the ventricles, or let's say, for instance, he also described that there was an abnormality in the size of the ventricles, that they were actually more narrow or smaller. They're not. This is actually appropriate in size. And he suggested that because of that, there's probably due to increased intracranial pressure. But that doesn't happen in isolation. Increased intracranial pressure is going to cause fluid from the ventricles as well as fluid from the vascular space to spill out into the actual brain tissue, and that's going to cause abnormalities in the CSF pattern, as well as it's going to cause hyperintensities around vessels. You see none of that here in this actual scan whatsoever. Not to mention, increased intracranial pressure is going to push the brain parenchyma out. The brain is trapped in the skull. It has nowhere to go. So if you increase pressure inside that skull, the brain is going to be pushed outward and downward. And you see no evidence of that at all here. You don't see any evidence. You see the normal sulsation right here, or the normal folds of the brain. You have no evidence of that increased intracranial pressure. More importantly, like I said, there's no overt evidence of abnormality in ventricle size, and that matches what the radiologist saw on both the CAT scan and the MRI.
And what was the radiologist's opinion on the MRI that we're
The
looking at?
MRI was that there was no difference in the size of the ventricles, and that's important too. I know he had mentioned that normally a person wouldn't make comment of that on an acute CT. they very well would make comment on that, because if you see asymmetry on a CAT scan, what it suggests is that there's perhaps some underlying mass process that's pushing or changing the size of that ventricle that needs further evaluation. So a radiologist would certainly make note of that, and a doctor would certainly have to follow up with that.
Now, he also mentioned about the space, made some issue about the space between the skull and the brain. Can you
talked
describe
about, yeah,
that?
sure. So this is a little bit higher up, so I can't really see the temporal lobes here, but you can certainly look at, so here's the frontal lobes of the brain. The orbital frontal lobes are the part of the frontal lobes that curve underneath. And normally when you're comparing the width of the sulci of the orbital frontal lobes, they're going to be a little bit wider than the normal sulci that you're going to see on the lateral frontal lobes, as well as the sulci that you're going to see moving posteriorly to the temporal lobes. So what he's describing here is just the normal spaces between the individual gyri of the brain. And how do I know that? Because the cortical, so if there was atrophy, you would have loss of brain substance. You would have loss of gray matter, and you would have loss of white matter. The cortical size is of normal thickness. There's no loss of cortical size. More importantly, the distance here is all normal. So there's no loss of white matter underneath here. You don't have atrophy in the absence of loss of brain substance. Brain substance is absolutely normal. More importantly, this is all, the white matter from here travels down through the center of the brain into our spinal cord. If you lose substance, you get an increase in size in the ventricles. That's well known, and that's not seen here. So I see no evidence of atrophy at all on this brain. More importantly, when you look at the temporal lobe, he describes changes in the amygdala and the hippocampus. There is no atrophy whatsoever that I can see at all looking at this. More importantly, any atrophy, if there was, certainly I don't think wouldn't have any behavioral readout.